Our group members consist of me, Siti Marini Bintu Zulkifli, with the metric number 2210358,
and me, Nur Zainisha binti Ramlan, with metric number 2211794. For this assignment, we will be going to review the case of Azizah Abd Manan and others, and Dr. Nur Lelawati Abdul Latif and others. We will start the discussion by discussing the material facts, the legal issues, the judgment, the legal analysis, and conclusion. Now, we will start with the material facts of the case.
The case started on 13 February 2009 when the plaintiff was admitted to the hospital of Sultan Aminah after bleeding for 6 days, and the urine test confirmed that she is pregnant, and scan showed uterus was empty and she was suspected to have ectopic pregnancy. On the 11th of February, a diagnosis of right tubal ectopic pregnancy was made, but despite this, the doctor continued with conservative management and waited for the ectopic pregnancy to rupture. However, the next day, the bleeding of the plaintiff did not stop and she had abdominal pain. On the 20th February, another scan showed an empty uterus with right agnosical mass with irregular gestation failing ectopic pregnancy of unknown location. Patient requested for discharge and was allowed. A few days later, patient admitted at emergency department where she complained of abdominal pain, nausea, shortness of breath, and palpitation. On the next day, another transvaginal scan was done and it showed that the disease had considerably bleeding from the pregnancy, and she was scheduled for emergency laparotomy as a leaking ectopic pregnancy case. The anesthetist assessed her and found she was having throat irritation and non-productive cough 2 days prior to admission, which was not noted by the doctors in the ONG ward. She was explained the danger of anesthesia due to her upper respiratory throat infection, and the paramount urgency for the laparotomy was also explained to her. She consented to the surgery. During the anesthesia, difficulty in intubation was encountered, and the plaintiff developed bronchospasm which led to pneumonia, and her condition worsened. She was managed in ICU as she suffered from left lung collapse. On 4th March of 2009, she was transferred to the Johor Specialist Hospital, a private hospital, at her husband's request. She was diagnosed as having post-operative nosocomial pneumonia with septicemia later. She developed complications of pulmonary fibrosis, pneumothorax, and pleural effusion. The disease was then transferred back by her husband to Hospital Sultan Aminah due to financial circumstances. She remained in this hospital until 6 August 2009 when her husband was advised that her condition would not improve and there was to be no further treatment. On the 3rd September 2009, deceased were discharged and later readmitted to Hospital Sultan Aminah. 2 days later, deceased passed away. The cause of death was due to sepsis secondary to pneumonia and sacral sore. Now, we will proceed with the legal issues of the case. In this case, we have two legal issues. Firstly, whether the plaintiffs have proved negligence on a balance of probability against the defendants in the treatment rendered to the deceased from the date of her admission on 13 February 2009 to her operation on 25 February 2009. Secondly, if the answer to issue 1 is in the affirmative, whether the plaintiffs have proved on a balance of probability that the deceased's death would not have occurred but for the negligence of the defendants. Next, the judgment of the case.
No.
The test that the defendant doctors had to establish to avoid liability for their acts or omissions was based on the test expounded in Bolam and Friend Hospital Management Committee 1957, also known as the Bolam test. By this test, the defendant doctors could exculpate themselves by showing the following. Firstly, that they had acted in accordance with the accepted medical practice, and secondly, that this accepted medical practice of theirs is regarded as proper by a responsible.
However, Federal Court held that the standard of care that doctors in Malaysia should now exercise is a question which is for the ultimate consideration of the court and no longer one for the medical profession alone to decide through a responsible body of medical opinion following the case of Australian High Court case of Rogers and Whittaker 1992. This can be proven through the testimonies from the expert brought by the plaintiffs, namely Professor Kulentam Arumugam, Plaintiff Witness 2, and Datuk Dr. Ravindan Jegasoti, Plaintiff Witness 6. The penultimate conclusion of his opinion on the cause of the deceased death is encapsulated in the following two paragraphs of his report. In my opinion, the crux of the case turns on the events from 13 February to 20th February. In example, her first in admission of Hospital Sultanah Aminah. The management of the patient during the admission set about a trend of events that finally led to the patient's demise on the 5th of September 2009. Had they managed her appropriately then, on balance, would think that the outcome may have been different. To me, the blameworthiness lay in the failure of the doctors of HSA to operate on her when the opportunity and the indications were there to do so. The patient has suffered the consequences of a lost chance. The court held that there was negligence by omission doctors who did not manage the disease case properly. She suffered the consequences of a lost chance because doctors failed to conduct the surgery before 20 February. The risk of anesthetic complications was created by defendants when they failed to operate on the disease immediately or soon after it was confirmed on 17 February 2009 that the disease was having an ectopic pregnancy and when the condition was optimal for her to undergo the operation. It was negligence by omission. If surgery had been performed before her discharge on 20 February 2009, the anesthetic complications would not have arisen and the surgery on 25 February 2009 would not have been necessary at all. By omitting to operate on the disease before discharging her on 20 February 2009, the defendants had provided the causative link to the anesthetic complications which eventually led to the disease death. For this reason, it is untenable for the learned senior federal counsel to argue that the same anesthetic complications might have happened if the disease had been operated on before her discharge on 20 February 2009. The suggestion is speculative at best. Further, the throat irritation and non-productive cough for 2 days that the disease was having prior to the emergency surgery should have been observed by the doctors on 24 February 2009 when the disease was readmitted but they were not. Thus, no treatment at all was given for her URTI. The fact that bronchospasm is a risk of operation which had been explained to the disease and that she had consented to go ahead with the operation cannot absolve the defendants of liability if otherwise they were negligent in creating that risk. The court held that on a balance of probability, therefore, the defendants are liable in negligence for the death of the deceased. The deceased received a total sum awarded to the plaintiffs of 484,990 ringgit 55 cents. Interest on general damages was fixed at 5% per annum for the date of service of the writ of summons to the date of judgment, 2% per annum for special damages from 25th March 2009 till date of judgment and 5% per annum on the judgment sum from the date of judgment to the date of full settlement.
Now, we will proceed with the legal analysis that consists of evaluation, our comments, and also the impacts of the decision on future cases. We are in the same opinion as the court, as firstly, we think that the defendant was indeed in a breach of duty to treat the plaintiff. The defendant tried to defend her decision of not exercising the laparoscopy on the plaintiff earlier since she needed to be sure of her diagnosis and did not want to rush as the surgery is risky. However, her decision of adopting the conservative management approach was proven to be an unsuitable approach according to the plaintiff witness, as it is an option for clinically stable women with minimal symptoms and a pregnancy of unknown location, as per plaintiff witness referring to article Guidelines of the Royal College of O&G. The plaintiff, on the other hand, was not stable as she had shown two cardinal symptoms of ectopic pregnancy and the pregnancy was known to be located in a gestational site outside the uterus. Not just that, a doctor should also try to find any other possible initiative as it is their duty to exercise reasonable care and skill It was also mentioned by both plaintiff witnesses that once an ectopic pregnancy was confirmed, methotrexate injection is one of the ways to terminate the pregnancy, hence avoid the surgery. However, based on the evidence, this form of treatment was not once considered by the defendant. Secondly, we also agree that the operation to remove the ectopic pregnancy should have been done immediately once its presence was confirmed on 17 February 2009. The cause of death of the disease was due to the complications suffered developed during anesthesia during the surgery at HSA on 25th of February. The defendant pleaded that the surgery could not be done earlier due to the fact that there was no definitive sign of ectopic pregnancy. However, from the earlier admission of the disease on 13 February 2009 to 20 of February 2009, the provisional diagnosis had always been ectopic pregnancy. Not just that, on 17 February, the ectopic pregnancy was firmly confirmed, yet the defendant continued with conservative management and waited for the ectopic pregnancy to rupture to finally perform the surgery. Thus, we are of the opinion that the defendant has created the risk of anesthetic complications for the failure to operate the disease immediately or at least as soon after the condition was confirmed on 17th February. Then, the surgery on 25th of February would not be necessary. The complication would not have arisen. Here, we can also relate this situation to court's decision on the case of Lim Zi Hong and Pengarah Hospital Selayang, where the courts find on the balance of probability that cerebral palsy suffered by plaintiff was caused by the failure of the defendant to carry out an elective caesarean section on the mother early. Thus, the delay in delivery of plaintiff showed the defendant was in breach of their duty. Next, we move on to the impact of decisions on future cases. Firstly, we think that this decision should be taken as a lesson to all doctors that even though doctors are not expected to achieve success every time, and the fact that patients must accept that every medical treatment carries a risk, doctors should still practice utmost care and skills in searching for the best option to treat the patient. Secondly, from the decision, the courts also need to seek opinions from multiple experts from both sides so that the judgment could be made with more confidence as there are opinions on many aspects of the case so that the court can minimize the possibility of leaving behind any important facts. The last element of today's case review is the conclusion. All in all, it is clear that a doctor owes to carry out their duty accordingly, which are duty to diagnose, duty to disclose risk, and duty to treat, where this case focuses mainly on the last duty, which is to treat the patient. In this case, the defendant was held liable for the death of the disease as although the fact that the risk of bronchospasm has been explained to the plaintiff and she consented to the operation, even so, it cannot absolve the liability of the defendant as they were still negligent in treating her as the risk was created by the failure of the defendant to operate her earlier or to exercise other options such as methotrexate injection. We are in the same opinion with the judge as from the facts, we can clearly see that the defendant fails to exercise reasonable care and skills toward the disease. That is all from us. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh. That is all from us. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.